Thank you for joining us here on the NPTE Final Frontier podcast. My name is Dr. Emily Gerby.
And my name is Dr. David Friedberg. Today, we're breaking down ankylosing spondylitis. All right, here is the question. A 29-year-old male presents with gradual onset of low back pain and morning stiffness that improves with physical activity. Posture reveals loss of lumbar lordosis and increased thoracic kyphosis. Which of the following physical therapy interventions is most appropriate? Is it option A, lumbar flexion exercises and moist heat? Option B, prolonged immobilization to reduce inflammation? Option C, heavy resistance strengthening and trunk loading? Or is it option D, extension-based postural exercises and deep breathing techniques?
All right, so let's review each of these option choices. And if we go back to that question stem, remember that our patient here is experiencing low back pain and morning stiffness that does improve with physical activity. Posture showed loss of lumbar lordosis as well as increased thoracic kyphosis. All right, so first up, we have option A. Option A's treatment was lumbar flexion exercises and moist heat. Now, while moist heat can provide comfort, flexion-based movements would really worsen the postural deformities here by reinforcing that thoracic kyphosis. Here we're suspecting a diagnosis like what? This question shows more of an ankylosing spondylitis diagnosis, so we do not want to emphasize flexion-based exercises here. We want to promote things like upright posture as well as extension. So with that being said, option A would not be ideal because again, flexion would reinforce that thoracic kyphosis. So we can cross off option A. Next up, we have option B, prolonged immobilization to reduce inflammation. This would increase stiffness. This would promote loss of mobility and could even lead to pulmonary restrictions, the opposite of what would be indicated here. So let's cross off option B. Then we have option C, heavy resistance strengthening and trunk loading. Now again, remember here we're thinking our patient has ankylosing spondylitis. So this requires gentle mobility and postural control, not so much high load strengthening, which could really stress fused joints and lead to increased pain. So let's cross off option C, which leaves us with option D. Option D is extension-based postural exercises. We like that, as well as deep breathing techniques, which we also like. So that is why this is the correct answer choice. Ankylosing spondylitis leads to progressive stiffness of the spine, especially in extension, and can restrict chest wall expansion as the costovertebral joints become involved. So interventions that promote spinal extension, postural alignment, and chest expansion maintain mobility and prevent deformity, which is why the correct answer choice is option D. Now I'm going to pass it back over to David to talk a little bit more about ankylosing spondylitis and why we think that is the diagnosis for this patient case.
All right, thank you for passing that ball. I got it, and now time to drive it down the court. Ankylosing spondylitis is a seronegative spondyloarthropathy that affects mainly young adult males. It starts at the sacroiliac joints and ascends the spine, leading to progressive stiffness and bamboo spine formation on imaging. Typical signs include morning stiffness that improves with activity, loss of lumbar lordosis and increased thoracic kyphosis, decreased chest expansion, and also pain that worsens at night or after rest.
So, given this patient scenario, some physical therapy goals that we would love to reinforce are encouraging that extension based posture. So, think of some exercises that could help encourage extension based posture. If you thought of something like maybe a prone press up, standing extension, those are some great examples. Some other things to do are maintain thoracic mobility and breathing capacity, because remember that chest expansion can be decreased. So we want to promote that. Emphasize daily activity and movement, right? They're going to feel worse with rest. So we want to promote that gentle mobility and that continued movement. While we want to encourage movement, remember what movement do we want to avoid? If you said avoiding excessive flexion, you are correct. Great job, Warriors. If you remember nothing else for the boards, well, we should remember a few more things. But when it comes to ankylosing spondylitis, remember when stiffness gets better with movement and the patient is a young male, think ankylosing spondylitis.
All right, now that you heard this episode of the podcast, here is a quote from Steve Jobs. The only way to do great work is to love what you do. So do not forget why you got started. Continue to find that love within the field and also within yourself, and go get it. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, TikTok, and X.
Till next time, have a great day and a powerful tomorrow.